Have you ever looked in the mirror and felt the terrible sensation that your penis seems smaller than it did a few years ago? Have you noticed that it no longer looks as full when flaccid? Or that your erections no longer reach the length and thickness they had in your youth? Have you wondered if it's just your imagination? If it's the cold, or if something is really happening in your body that's causing your member to shrink? Do you fear that this process will continue until you lose much of your size and functionality? If you're over 50 and have noticed a visible decrease in the size of your penis, or if you simply want to prevent this from happening, this message is crucial for you. I am Dr. Sanchez, a specialist in preventive medicine and men's health, and today I'm going to reveal the uncomfortable but necessary truth about penile shrinkage. Why does it really happen? What hidden habits accelerate it? And most importantly, how can you stop this process and unlock your true size once and for all in a natural and scientific way? Stay with me until the end, because the solution may be simpler than you imagine, but it requires immediate action. To understand why the penis can appear to shrink, we must first debunk a myth. The penis is not a muscle that atrophies from lack of use in the traditional sense. The penis is a vascular and spongy organ composed mainly of two cylinders called the corpora cavernosa. These cylinders are made of erectile tissue, a complex network of empty spaces lined with smooth muscle and endothelium, surrounded by an elastic sheath called the tunica albuginea. The size of your penis, both flaccid and erect, depends almost entirely on the health of these tissues and the amount of blood they can hold. When you're young, these tissues are extremely elastic, rich in collagen and elastin, and your arteries are clean, allowing massive blood flow that expands the penis to its maximum. However, over the years, a series of biological and lifestyle factors begin to damage the structure. Elastic collagen is replaced by rigid fibrous tissue, arteries narrow, blood flow decreases, and as a result, the penis loses its ability to stretch and fill completely. This is what you perceive visually as shrinkage. It's not that your penis has disappeared, it's that it has lost its capacity for full expansion and retracts due to lack of oxygenation. The devastating psychological impact of this progressive shrinkage on a man is profound. You start to feel less virile, less potent. Every time you go to the bathroom, the sight of a retracted penis reminds you that you're aging, losing abilities. This insecurity carries over to the bedroom. You're embarrassed to undress in front of your partner, you turn off the lights, avoid eye contact. During sex, you're worried about not satisfying her, not filling her like before. Anxiety about size kills your erection, and a weak erection makes the penis look even smaller, creating a vicious cycle of failure and frustration. Your partner may notice your emotional withdrawal and think you're no longer interested in her. Lack of physical intimacy leads to emotional distance, and many solid relationships crack due to unspoken insecurity. Additionally, physical shrinkage often comes with reduced sensitivity and weaker ejaculatory force, making sex less pleasurable for you. You feel trapped in a failing body, unaware that many causes of this shrinkage are reversible if you act in time. In desperation, many men seek quick and dangerous solutions. Penis extenders that promise miraculous results but can cause nerve damage and internal scarring if used incorrectly. Lengthening surgeries like sectioning the suspensory ligament, which can leave the penis unstable and with permanent erection problems. Injections of fillers that can cause deformities, serious infections, and tissue necrosis, or unregulated herbal pills that only empty your wallet. The vast majority simply resign themselves, thinking it's an inevitable part of aging, and let the process continue until erectile dysfunction becomes total. But before you resign yourself or turn to dangerous solutions, here's the good news. Penile shrinkage is not a definitive sentence. It's a symptom that something is wrong with your vascular and hormonal health. By addressing the root cause, you can stop the process and even recover some lost size. The first real cause of shrinkage is lack of tissue oxygenation due to poor circulation. The penis needs oxygen to stay elastic and healthy. This oxygen arrives via blood, mainly during involuntary nocturnal erections while you sleep. If you have arteries clogged by cholesterol, high blood pressure, diabetes, or smoking, oxygenated blood doesn't reach properly. Oxygen-deprived penile tissues undergo a process called cavernous fibrosis. Healthy, smooth muscle cells die and are replaced by rigid, inelastic scar tissue. This fibrous tissue contracts, shortening and narrowing the penis. The solution is to recover cardiovascular health. Quitting smoking is absolutely crucial. Tobacco is the most potent vasoconstrictor and directly damages erectile tissue. Controlling blood pressure, blood sugar, and cholesterol is vital. Regular cardiovascular exercise is the best medicine. Brisk walking, swimming, or cycling improves systemic blood flow and delivers restorative oxygen to your penis. The second cause is weight gain and suprapubic fat. As mentioned in other videos, fat accumulated in the pubic area buries the base of the penis, hiding up to 2 to 3 cm of length. But there's something worse. Visceral fat produces inflammatory substances that attack vascular endothelium and reduce testosterone. Obesity converts testosterone into estrogen, the female hormone. Low testosterone and high estrogen cause decreased libido and, worse, reduce the frequency and quality of nocturnal erections. Without those maintenance erections, the penis isn't stretched regularly, accelerating fibrosis and shrinkage. The solution is clear. Lose body fat. An anti-inflammatory diet rich in protein, healthy fats, and vegetables combined with strength training will not only reveal the buried penis but normalize your hormones and reactivate the nocturnal repair mechanism. The third cause is prostate surgery, radical prostatectomy for cancer treatment. It's a known medical fact that many men experience penile shortening of 1 to 2 cm after the surgery, due to nerve and vessel damage during the operation and lack of erections in the postoperative period. However, this is not irreversible. Early penile rehabilitation is key. Daily low-dose medications like tadalafil and supervised use of vacuum pumps right after surgery can maintain blood flow, stretch tissues, and prevent fibrosis, minimizing or completely avoiding shrinkage. The fourth cause is Peyronie's disease. This condition involves formation of hard scar tissue plaques under the penile skin. These plaques cause curvature during erection, pain, and very often shortening and deformity. Peyronie's disease can be triggered by microtrauma during vigorous sex or have a genetic component. If you notice new curvature, a hard lump in the penis, or pain during erection, see a urologist immediately. Medical treatments exist, injections of collagenase, shockwave therapy, and surgery that can correct curvature and recover some lost length if treated early. Now let's talk about how to unlock your size and reverse this process. The definitive strategy is based on 3 pillars: oxygenation, therapeutic stretching, and hormones. Pillar 1, maximum oxygenation. We've discussed diet and exercise, but you can enhance it with supplements that boost nitric oxide, like L-citrulline and beetroot juice. These natural vasodilators open arteries and flood the penis with oxygen-rich blood. Pillar 2, therapeutic stretching. Using a medical-grade vacuum pump, not cheap sex toys, for 10-15 minutes a day, 3 to 4 times a week, can be highly beneficial. The pump creates a vacuum that forces blood into the penis and stretches tissues in a controlled, safe way, breaking microfibrous adhesions and stimulating elasticity. It's like physical therapy for your penis. Always consult your doctor first to learn the correct technique and avoid injury. Pillar 3. Hormonal optimization. Ensure your testosterone levels are optimal for your age. If low, supervise testosterone. Replacement therapy can reactivate nocturnal erections and halt atrophy. Imagine Miguel, 58 years old, who noticed his penis had lost nearly 2 centimeters and his erections were weak. He was 12 kilo overweight and pre-diabetic. He was scared but decided to act. He walked 45 minutes daily, eliminated sugar and refined flours, and started an L-citrulline supplement. He lost 10 kilo in 4 months. His buried penis reappeared. His blood sugar normalized, improving circulation. He began using a vacuum pump under urologist supervision to exercise the tissues. 6 months later, Miguel recovered not only his previous visible size, but had firmer erections than a decade ago. There was no magic, just commitment to vascular and metabolic health. It's essential to clarify, unlocking your size doesn't mean growing beyond your original genetics. It means recovering size lost to fibrosis, poor circulation, and fat, and maximizing your erectile potential. If you have severe curvature, persistent pain, or palpable nodules, seek urgent medical attention to rule out advanced peyronie's or tumors. Never attempt aggressive stretching exercises or jelqing from internet forums. They can rupture blood vessels and cause irreversible fibrosis, achieving the opposite of what you want. You don't have to resign yourself to watching your virility shrink day by day. You have the power to stop this process and reverse much of the damage. Your penis is a barometer of your overall health. If it's shrinking, your body is screaming that your arteries and hormones need help. Listen to that signal. Act today, recover cardiovascular health, lose toxic fat, and consider safe vascular rehabilitation therapies. That's choosing to age with potency, confidence, and control over your body. If this information has opened your eyes and given you a clear path to action, like, subscribe to the channel, and share this video. Thousands of men need to know that shrinkage isn't a life sentence. It's a reversible warning sign. I am Dr. Sanchez. Thank you for trusting, informing yourself, and taking control of your health. See you soon.